So if you have these symptoms, you talked about things to look for. Why do these symptoms occur? What's the underlying pathophysiology? How do you understand why they're there? Intracranial pressure-related headaches really are dictated by this thing, the Monroe-Kelly doctrine. So basically, the idea is that the brain and its contents are surrounded by an inflexible skull. So there's a fixed volume, and there's only so much stuff that can fit inside of it. So in an adult, that's about 1.5 liters worth of volume. The brain itself takes up about 80%. The spinal fluid is 10%. The blood is 10%. And the issue is in kids, their skulls may be smaller, but the principles are the same. Brain pressure historically is reported to be about 20 centimeters of water or 20 millimeters of mercury in adults, but it's important to note that ICP is normally lower in kids. It may be 10 to 15 in kids, 5 to 10 in infants, and maybe subatmospheric in newborns, although this is certainly open to debate, and a number of papers recently have suggested that perhaps those numbers may be higher in some cases normally. That said, the principle is the same with this Monroe-Kelly doctrine, that there are simply 3 components of tissue that are contained within this rigid vault of the skull, and when one volume increases, the other ones have to have compensatory changes. Otherwise, normal regulatory functions are overwhelmed and pressure increases. And this is an example of a compliance curve. As brain pressure is challenged by increasing volumes, at first these compensatory mechanisms can work. So spinal fluid may be shunted down to the lower part of the spine, blood flow may be rerouted, and so even though there's increases in volume, there may be very little increases in pressure. However, once a critical point is reached, there's really no longer any compensatory mechanisms that can be used, and then very tiny changes in volume can have rapid increases in pressure. And that's where a headache, which can be sitting lying for a long period of time, can very rapidly change to coma if they're passing that critical compliance point where they no longer have any compensatory mechanisms. And this is why, as the brain is pushed, you have a sort of standard progression of transtentorial herniation as the brain gets squished from above and gets pushed down. First, you may have headache, then you may have some altered level of consciousness, then you get the uncal herniation, as I mentioned, and really the final red flag is the Cushing's triad as the brain gets pushed all the way down to the brain stem with bradycardia, hypertension, and respiratory arrest. So seeing this progression over time really would warrant urgent intervention.